Good morning, everyone. Welcome to April 19th, 2021, our regular school board workshop. Before we begin the work of the district, let us stand for a moment of silence, followed by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have one public input card, Mrs. Cronin. Mrs. Cronin, if you'll give your name and address, and you have 3 minutes.
Good morning, board members, superintendent. Kim Cronin, 6531 Dewey Robbins Road in Howie, representing SEIU. Just want to talk a little bit about what you're going to be voting on for the insurances. Seems like every time we put something out for bid, we come back with saving some money for the district. We're saving some money for our employees also. Also wanted to talk a little bit about the health insurance. Very happy to know that we're not going to see an increase for employees this year. A couple of years ago, we changed the plan somewhat so that we could build a reserve, and it seems like that's worked. So I'm hoping in the future we're going to see maybe some changes back a little bit more to what the plans were before we made these changes to save the employees some money. I also wanted to take this time to thank the superintendent and her staff for all the work they did to help get our employees and students vaccinated. That was, I think, something that I really haven't heard any other school districts doing, so I really appreciate that. And I also greatly appreciate the fact that you are keeping masks mandated for the rest of this school year. Thank you.
Thank you, Mrs. Cronin. Okay, first topic happens to be Insurance Committee recommendation. Mr. Ward.
Good morning, Board. I just want to take the opportunity to bring in our consultant for the district and let him go through a presentation. Items that were recently put in front of the Insurance Committee and voted for recommendation. We'll be bringing those up to future board meeting, but want to give an opportunity for our insurance consultant to go over the information.
Great, thanks, Nick. Appreciate it.
And this is Josh Rubik with Gallagher.
Great. Hey, good to see everyone again. Thanks for having me. Right, so we have it up on the screens as well for talking to the mic for those of you who are virtual, but what we're going to be looking over today is just the process that we went through and several of the, some of you could say are insurance related, like the life and disability, and then the Onsite Clinic, which again is technically not insurance, but certainly is part of the overall health and welfare budget. So we're going to talk about the process, ultimately the outcomes here, and then what are the savings, and then dig into a little bit of the details. Okay. So first and foremost, I'm on page 3 now in the bottom left-hand corner. In terms of the process, so the Joint Insurance Advisory Committee did establish an RFP subcommittee for both of these areas. Subcommittee was comprised of a combination of Lake School staff as well as an LCEA and SEIU member for both of those. So a good combination, right, of both that were on there. The subcommittees did receive the full RFP responses as well as summaries for both benefits and the pricing in terms of their review. Those responses were scored to shortlist, and then there were finalist meetings that were done via WebEx for the subcommittee to interview each of the individual finalists, and then ultimately they were scored immediately after each RFP or each finalist presented, and then therefore we had a recommendation. The recommendation was presented to the Joint Insurance Advisory Committee, and it was approved on that side as well. So just a little bit about how we arrived as to where we are. The first one that we're going to be referencing is the Onsite Clinic, or also known as the Wellness Centers. The incumbent is Care Here. Ultimately interviewed 3 finalists, including Care Here. Care Here was the winner of that particular bid, and as far as an annual savings delivered on the administrative fee, and we'll get into how Care Here is paid and what the cost of those are. On the administrative fee, there's approximately $75,000 in savings, and then we note cost avoidance of $75,000 for a telemedicine benefit. So cost avoidance meaning if Lake County Schools were to procure said benefit on their own, we would value that at about $75,000. I think we all can agree in the environment that we are having a virtual, benefit is value add. So Care Here's providing that within the contract at no additional cost, and there's also some continuity benefits in that if someone calls the telemedicine provider, it directly goes into the electronic medical record at the clinic, so they don't have to re-explain, right, what the issue is. And I should note that that's a savings over and above. There was a reduction last year, I believe, at this time as well, with just a contract negotiation. On the life, disability, and EAP RFP, 2 finalists were listed there. Sun Life is the incumbent on the life and disability, and Aetna was the incumbent on the EAP. There is going to be a change, or recommending a change, rather, I should say, to the standard, and we listed the savings there. So we separated that out by board pay and employee paid. You can see, so certainly good savings on both board and employee side, and some benefits added. For this year only, employees who are enrolling in the disability and life insurance, doesn't matter if they've been at Lake County Schools for 3 months or 5 years, they can enroll with no medical questions asked and guarantee issues. So typically, if you miss your initial enrollment period in disability or life insurance, if you want to enroll next year, you have to answer a series of questions. Those questions are being waived for this time. So that's a good benefit for those that might have missed their opportunity previously. All right, in terms of I don't read this necessarily line by line, but this will make more sense when we get to the next page. But the pricing methodology for the Onsite Clinic, there's really several different buckets of fees that you pay. You pay the administrative fee, which is really the easiest, right? That's a per head amount that you pay, and that pays for Care Here to operate the clinics. That's their corporate overhead. That also pays for your account management services here and your clinical services director here. Then you also pay for the professional fees, so those would be for the actual doctors that are on site, for the nurses that are on site, for all those individuals. So look at that as a labor pass, that's a pass-through cost. And then the more variable cost, which is actually the least amount of what you pay, would be for really materials. So supplies, equipment, medications, things of that sort. Go here. Okay, I'm now on the next page, which looks a bit like an Excel grid type. All right. So first I'll start with the employees. So the assumed employees, this was based on the census from Lake County Schools. You'll notice slight deviation on My Health and Proactive. It wasn't material enough, and we didn't adjust it just because we don't want to be messing with people's numbers as they respond into RFPs, but a couple employees overall. Immaterial. You'll see the subtotal fixed costs, which is the management fee. So that's where that $75,000 savings is coming from that I referenced 2 pages ago. The professional fees, so those are the doctors, nurses, other professional staff, and then if there's an implementation fee. That we'll just focus on Care Here for a moment. That totals about $3.7 million. And then when you add in the pass-through cost, about $4.6 million. So you can see the bulk of the cost that you pay really are on the providers. So you're paying for doctors and nurses. That's the vast majority of the spend that ends up being paid through here. Okay. So if we look, if we want to just focus on the subtotaled cost, you can see as we look through here that you certainly could pay more by looking to the provider directly to the right, and almost at a relatively substantial amount more there, and then even Proactive MD being more on that side as well, with both HealthStat and My Health being slightly less. When we look at the medications, labs, and supplies, really Care Here directionally the same with a couple of variances, and the biggest reason for the difference is what the other clinics were maybe willing to stock in terms of medications. So I think the one that looks most glaring, for example, is Proactive at a pretty small number there. That's for a few reasons. One, they were bucketing some of their labs and supplies into their admin fee, so saying, hey, this is included, but basically charging you more for it. But primarily, they were only covering 50% of the medications that were in there, which is a pretty, I think, a relatively stark difference on that side.
What about?
So-
Yes.
Go ahead, Mark.
So we would expect, so even if some people look at this chart and they say, oh, look, the district would have a savings, but in reality, that savings would negate itself when the employee pays more because they'd have to go elsewhere for some medications that these folks don't stock. Is that what you're saying?
Correct.
Okay.
Can
All
we,
right.
what kind of medications? Are these OTs, over the counter, or?
No, the district at this point does not cover over-the-counter medications anymore, so they do supplies within it's definitely a dispensary, it's not really a pharmacy, generic medications, but it varied the gamut from different condition states.
And well, I had as we were moving through the year, obviously, we've had a pandemic. It felt like Care Here just totally tapped out and was like, no, we're not bothering with tests. At what point did they actually get tests? Or do they even have them now? For, like, people who have COVID, because they, like, didn't have them forever.
You're
So-
talking about COVID tests in specific?
Well, yeah, like,
Yep.
they just were like, well, we're not really doctors in this. We're not gonna bother, like, trying to get tests like every other doctor in the world was. So, when did they? Like, at what point?
I have to go back and look at the date, but my understanding is they are testing at this point, so that's.
Right, so I guess
unfortunate to hear.
I guess I have a little bit of a frustration with their, quality standards that I saw, you know? Like, I kept saying, but what about Care Here? Oh, they're not doing anything. Oh, but what about Care Here a month later? Oh, they're still not doing anything. So I just want to express that frustration. I don't know. I mean, I doubt it would change our vote, but I don't think that they provided particularly good care here.
And we have an audit that,
Oh.
and our auditor did an audit of the care. I don't think that turned out very well for them.
I think, I don't know if, Scott, you want to reference, but my understanding on the audit is there was some, in terms of number of visits and whether or not, how they justify what the return on investment is, which I would say is, we take issue with, I think, with a lot of these vendors and just what they determine that end. But, I think and Ms. Burns will take that back in terms of that particular and see if anyone else did. I know that in terms of the survey scores that Care Here receives, because they do a survey score afterwards, it appears to be overly above strong, but you bring up an interesting point that maybe we should look at that within a confined time period and see if there's some other information that we can glean from that.
Within the request for proposal from these vendors, why would they not give them the same number? The real difference is in that area, by the way, across the board. And so why would they not be told to bid exactly what Care Here is the benchmark, have everyone bid to that? Why would we allow deviation?
We did not, so we did provide the correct numbers
They just
to
didn't.
them. When they
didn't.
responded back, that's the numbers that they gave. So you'll see Care Here.
And there's a
has-
list where they say Care Here's doing it for this much and we're not doing it?
When you say the numbers, are you referencing?
I'm not, 594 versus 877 on health stat. That's the only one I'm looking at. Because it's almost exactly, it's
The medications labs.
$183,000.
So my understanding is they
Oh.
kind of gave us the numbers that they would project based on the population, whereas Care Here actually has our people and knows exactly what our people have been using in the past. So obviously, because they've got the direct history, Care Here would have the right numbers or the more correct numbers as to what to estimate off of.
Yes.
And we did not give
No,
we
we
did not
did.
give these bidders our
No,
numbers.
we did. Yes,
We
it's
did.
a good question, Chairman Theis. So we, in terms of the data that was provided to them, they were provided several pieces of information. They were provided an employee census, which is where the head counts came from, and then they were also provided annual utilization reports. So you could see how many labs were provided, how many tests were provided, how many medications were dispensed. They were given a full list of medications there, and then the vendors were asked to reprice that based on the utilization stats that were provided. That said, they can reprice it how they want. They're not held to that. So unlike maybe a fixed cost, this would be considered more of cost plus perhaps in the construction type industry. So HealthStat, for example, would not be held to that 594.
Are you then saying Care Here wouldn't be held to the 877?
It's all based on, as I referenced on kind of the prior page, that's based
So-
on budget and utilization. So if you have more people that are going ultimately to the clinics, you would pay more. If you have less people going, you would be paying less. The piece that they would be held to would be the subtotal fixed cost, because that is indeed fixed based on professional and admin fees.
The other one's just an estimate based on what they predict
Correct.
it will cost based on the information.
No, that's not what you're saying. They were given the usage, so they would have based their number based on data from the prior year, right?
Correct. Yes, they would do it based on that, and then they would make a projection as to, well, just, for example, if last year Lake County Schools had less people and this year they have more people, you would make the assumption that you would presumably have more utilization the more employees they have.
But when they gave these proposals, they were giving those numbers that did, right?
Correct.
This is last year's.
Correct.
And based on last year's numbers, Health Stat provided identically the same service as Care Here did the year before, and this is what they would have charged.
That is what they're suggesting they charge. Now, I would submit that if we look at some of the other numbers, that's interesting. Care ETC thinks it'd be $1.8 million, which is almost the bookend approach, if you will. Marathon's slightly less at $714, and then My Health is more on that side. So Health Stat, you could maybe even consider an outlier, and you could consider Care ETC likely an outlier as well, just in.
But I think it's important to
What
make
do
the
you mean by an
distinction
outlier?
between what they're suggesting. So are the numbers specific to what they were given? And that's what
Yes.
their numbers would have been, or were they making a projection about what they think it would cost? That's two
Those
different
are
things.
two different things.
They're making a projection based off of the information that they were
So they didn't just take the
provided.
numbers and make the cost fixed.
It's not fixed, yes, if that's what you're asking.
It's
No,
not,
but
it's
did
not.
But did they take the numbers that we did last year
And back
and
out.
reduce the number that they projected to be a reduction to come up with less?
Yes, but not on a line item basis. So they would say labs was X, we think labs will be this, but not on this particular COVID test, for example, was X, it would be this, or this particular blood pressure test was X, it'll be this. It'd be a lump in lab number, a lump in medication number.
Why would they not have bid exactly empirically what we had as data from the year before the request for proposal? Why wouldn't they take exactly the services? Because that's what Care Here did, right? Care Here took their exact numbers.
Well, we had their exact numbers, I think, right?
No, we do. We have the numbers.
Well, yeah, because there are numbers. So then we gave them to the other companies, right?
So you throw in this hypothetical, they're gonna, based on this, they're assuming they're gonna use these
Right.
services less, right?
And part of that, Chairman, is they believe that they can control or they can work with behaviors and make some changes. And if you look at like Proactive MD, they're so low in their medications and supplies, and one of the things that they said was, we only cover about 50% of the drugs that Care Here covers, so they only priced what Care Here actually, what they covered that Care Here covered. The other 50%, they didn't even price that out, so.
But that's what I was asking.
Yeah.
So if the benchmark was Care Here, that outlier that you spoke to was exactly right, this Proactive, they wouldn't have made the list because they didn't provide the same services.
Right.
Right? So I'm confused, and because of remember our audit report on Care Here, why we
Right.
didn't give more attention to Health Stat, that's all. I don't disagree with the two outliers.
Aside from Proactive, do these other four all provide the same services, all the medications, lab supplies, health assessments as Care Here? Or would our employees have to be going elsewhere looking for those things?
It's similar, though it wasn't as large
So
of a
what,
difference.
what pushed the decision to Care Here as opposed to Health Stat?
So I think, so several different reasons. I think the largest being that, and this isn't in primary, but one, you can keep on all of these, just to be fair, Care Here, the providers would stay the same. So there is a, hey, would we have to change providers out? There, that being one. The additional telemedicine benefit was value add as well. And then just the overall, I think,
It's
presentation
value added of
approach.
$75,000.
I'm sorry?
It's only $75,000 out
No,
of,
it's a $291,000.
no, the
Oh.
telemedicine thing.
Correct. Correct. The, and to be, in terms of
So
the,
not changing doctors, telemedicine, and what else?
those would be the primary in those end. And you asked on HealthStat, to be fair, the finalists were Care Here, My Health, and then Proactive ended up being the finalists.
And is it not reasonable to assume that what we're really talking about is the management fee? The professionals probably would stay.
Correct.
Doctors would
I
probably
think
stay,
it'd be,
right?
I think the professionals should be directionally the same. I think saying that you're gonna save $300,000-400,000.
I'm talking about doctor for doctor, like if, I don't know if, I don't take advantage of this, but do you go to the same doctor every time?
I don't either.
I know a lot of folks who do pick the same doctor every
So
time.
do we think that they would just retain those doctors because the professional services are professional services? And what we're really looking at is the management and the medications, in my mind.
That's where your largest opportunity
Right.
would arise in terms of the cost, if that's what you're asking, I
It
think.
is.
Yes.
Okay.
I guess going back to I'm still trying to wrap my head around this medications, lab supplies, that line there. So if these other folks who are predicting less of an amount, their pricing, are their prices item per item cheaper than Care Here, or they truly just saying, oh, we're gonna need to use fewer medications, or our patients aren't gonna need to get as many labs as Care Here patients?
Yep, so good question. So combination of the two. Some of the providers will say, our approach is we don't think they need a test, we're not gonna give them a test, whereas others will say, hey, well, our unit cost pricing is lower. So I think the answer to your question, it's a combination
Combination of both.
of the two.
I guess it's hard to know. On one hand, I'm nervous about just maybe some folks here have just kind of oversold themselves, going, hey, look at all these savings you're gonna get, and then they're suddenly operating our facilities, and well, those savings aren't there. I guess some of these patient behaviors don't really change as they predicted. I don't know.
But that's the part that I'm confused about.
Yeah.
They were given the medications and the number of procedures. Where did it allow in the request for proposal for them to use some kind of actuary and say we're gonna use less? Where, was that part of it would have seemed straightforward if you compared medication to medication, procedure to procedure.
Yep.
Right?
Yep.
And they
So-
didn't do that?
No, so on the medication side, they had probably I don't know how many rows that was in it, probably 1,000+ row piece. So that one's probably the most, I think you could say, absolute to look at. This is $3, this is $2.50, this is $3.75, this is $4.25, and you kind of tick and tie on that side. On the lab side or the supply side, that's more of a bucketed number with, here's how many labs that we utilized, here's how many supplies that we utilize, not this syringe is $1.75 or $10 or whatever the number is there, which I think is what your question is.
Sort of. Okay, so in the spreadsheet that lists all the medications, let's just stay with that one for a second.
Okay.
How did these, and I'm kind of down to two, but how did these two fare, HealthStat and Care, based on that number? Was there a savings or not a savings? Pill for pill?
I'd have to pull that up now to say for certain.
Do we have that?
We can get it. I don't have it.
Get it.
Oh, we don't have it.
Yeah, but
And
we
procedure for procedure, like if I'm going to have an x-ray, right, that's a lab,
Yep.
then procedure for procedure,
Is
what's
that-
the difference?
Did the committee look at that?
No, we did not look at the individual detail to that nature.
So what, okay, so,
So one of the things that we were really concentrating on is what we know and what we don't know. What we don't know is a variable. That can change tomorrow. We can go through another pandemic. We could have something else kick in. So the variable is something that it's important, but we don't weigh a whole lot in there because they have a lot of flexibility on how they price their variable. They can say their programs are better. They can say they do different programs. But at the end of the day, until it actually happens, we don't know what the variable is going to be. So we really weighed heavier on the fixed costs, and that is the management fee per head and the staffing program that they come up with when they did their programs. And you can see that Care Here and HealthStat were very similar, and the reason being is because the HealthStat, they were formerly Crown. If you recall, Care Here used to be Care Here Crown. And so they had a lot of the same information and the same numbers because they used to partner with Care Here, and now they've split. So back in a long time ago, when we started looking at this was long before I was here, Crown was the one who brought the health places, the health clinics to a lot of the school districts and started the whole process of having them do their own clinics. So they're experienced. They've got a lot of background, and again, they had the same numbers that Care Here had. So we knew that going in, but one of the things that the committee was concerned with, and I was too, was that I do know that a lot of our employees do use their doctors consistently as their primary care physician, and we felt like changing the benefits or changing the doctors would be disruptive to the clinic program and the employees.
But for me, I guess it's just in the back of my head that we also had our internal auditor audit Care Here, and that was not stellar. That's all.
And a lot of what Tom's audit showed, which I agree with, is a lot of the claims that they have about how much they're saving us are kind of a stretch, to say the least. So, what they weigh in as metrics that they believe that are important is, the number of visits. And we know that a lot of times they encourage a lot of additional visits. So, I think the main thing there is that we kind of have to hold them more accountable to some better metrics than what they've been putting out in the past, which I think it's been about 2.5, 3 years ago since they did that presentation, and we haven't seen that page again, so.
Right.
But we also haven't, I don't think we've seen, have we seen it, are we getting value for our money, right? So we've shown through an audit that they're full of a bunch of baloney, right? And they're
Not a bunch, but
a
enough to be
fair amount,
concerning.
a fair amount of
Enough to be
baloney.
concerning.
So it is concerning to rehire the same company that is spewing some nonsense at you. It's frustrating, especially if you have the same fixed cost. I do understand wanting to keep primary caregivers, but I don't know if that's
Well,
such a
I would
priority.
and I don't know if this helps in terms of taking the audit aside. I think our position is just a general industry rule. We think a lot of these providers and how they determine what ROI is leaves a lot to be desired. So for whatever that's worth, I don't take that as really a Care Here problem, but more of just an industry. Here's what we're doing for you, and they're setting trend numbers that, hey, if healthcare trend is at 10% and your cost only went up by
Right.
3, we saved you 7.
Right.
Well, who knows that you
But
you
we also
did.
had issues with number of visits and things like that too. by the
Right, because
way.
I think they straddle sometimes.
I mean,
we-
My
we
point
And
worked
is-
excess labs.
Right.
We've worked
That's-
on some of that with them about trying to tone down some of the extra visits
But you're working
and
with someone
medications.
who we're going into another business relationship with that I'm not comfortable with.
Right.
But also, are the professional, I want to ask this one more time. So the doctors, are they employed by Care Here, or are they independently contracted?
They're employed by Care Here.
Okay. So there would be a change of doctors.
So the surprise to me is that I thought a lot of folks were dissatisfied with the level of service that they were getting at Care Here, but you were saying that they get a survey each time they visit, and those numbers look reasonably good.
That was exactly what I was actually going to say, is that we have gotten some feedback that doesn't necessarily show that it's stellar, that they're happy with the program. But I also realize sometimes we do hear from people that are upset about something. Would there be a way for us or for Gallagher to follow up with people at certain benchmark times throughout the year to just say, was your visit resolved? Because even in the spot, I might leave the clinic and say that was a great visit, and then 2 weeks later, my problem's not resolved, but I don't get to give that feedback. I think the quality that we're looking for is not what's being presented in the pricing. So is it a good program? Are we taking care of our employees and getting a cost savings to the program? And I'm not sure that, we're hearing conflicting data on that end too.
Could I ask Mr. Klatt or Ms. Cronin, do y'all have an opinion? I mean, it's your troops. If you have one, to the dais,
Kim?
please.
Honestly, I did not sit on this committee that went through this bidding process. One of the employees did, is one of my members. But I've had complaints about Care Here also. I don't think it's really the complaint of the care and I get complaints that there isn't enough appointments, that they wish they would have walk-in type of appointments available also. I think that a lot of the issues that I was kind of bringing to the table was the cost of the ultrasounds, brain scans, different things like that, that I was not aware and other people weren't aware that if they went through Care Here, it's free, but it's really not free. Somebody's paying for it, right? And that's actually the committee, your insurance fund that's paying it. But I don't get a great amount of complaints with that. I get complaints about how many times they have to have a visit to get a prescription refilled. So if they have 3 prescriptions, they got to have 3 appointments. So there's different things like that I think were a problem. But unfortunately, I didn't get to sit on this. One of my members wanted to sit on the committee. So
Thank you. Thank you very much. And that goes to when we audited, they would charge for 3 visits.
Right.
Excuse me, Mr. Clapp?
I think they did correct some
To-
of
to
that. So
That might.
you did have to do separate visits, or they allowed longer 60-day rather than 30-day prescriptions. So generally, I haven't heard any major issues. Folks, and again, just like Kim, one of my members sat on that committee, I didn't, so I didn't have a chance to go through all of this data as well.
Madam Chair.
Thank you.
Mr. Chairman,
Yes, ma'am.
I am the board's representative. I'm a non-voting member. The last 2 meetings I did attend via Zoom. From the committee standpoint, I think there are a lot of things being brought up today that were not a part of the committee's discussion. What I remember distinctly was that committee members were very concerned about cost to the employees, which, is important. They were very concerned about consistency of the physician, which again is important. I don't know that, and also being newly elected, I was not aware of the audit. So I think that probably the committee's concerns were a little bit different from some of the ones I'm hearing voiced here today. So it may be possible that Mr. Gallagher could help us out with some of those things and just get us some answers. Because some of your questions, I don't recall them being addressed, such as, complaints and being charged for 3 visits to get 3 different prescriptions, and that kind of thing.
Right.
It was mostly, I think the union membership, both classified and non-classified, was primarily concerned with making sure they got a good deal for the employee. They're very concerned about the premium cost. So.
Thank you.
Certainly, I also, just personally, my in-laws are Dr. Carlson, and I brought up, I need a new GP, because every time I get a GP here in Lake County, I lose it, within 6 months or 9 months or a year. And they looked at me the other day and they said, do we even have those anymore? Because it's just a hard thing to get a consistent GP in Lake County. Which leads me to, it's very nice to have a consistent GP, general care provider, but if we can get better service from health stat after all of these years, this might be the time to switch.
Because they're
And maybe
actually-
we need to send this back to committee.
They're actually investing more dollars in the professional side than Care Here is, which is the doctor.
And I think the doctors are what we're hearing the people like.
Right.
And I suspect even if they're employees, they might stay.
So when we
If they
looked
want work here.
so when we looked at the professional fees, they were actually adding positions. So their
Who's they?
amount,
Who's they? Health staff?
health staff, so their amount per doctor was actually going down, what they were paying each doctor.
So they're going to add more doctors, which in my world would mean better service.
Well,
Pay them less.
it wasn't necessarily doctors, it was, health
Physician
providers,
assistants or something.
PAs, yeah.
There's nothing wrong with the PK.
Those are good.
Right. Okay. I guess we move on.
To me, I guess I feel like I wonder what our employees really think about all this. It's hard to know from just a handful of opinions. where the majority lies. You know, I don't know how many of our folks are that passionate about the doctorate care here to be outraged that now we've switched, you know, and they've lost that relationship. I guess I don't know about the true quality of these visits, if it's a very vocal minority, or if it's how widespread the problem was.
I wonder if it would be helpful, particularly for you, Vice Chair Luke, if we included within and taking this into context within a service level agreement in terms of, you know, satisfaction levels being above a certain point, or allowing people to have kind of 2 bites at the apple as to how they rate in your
Right.
example that you gave there, or you know, passing, you know, an audit in terms of 3 visits, you know, is one, you know, 1 visit, not counting as 3 visits there, and, you know, attaching that to a performance guarantee to make sure that we're addressing some of these other items.
And if we were going to do that, why wouldn't we save an additional $291,000? Put the same requirement on health staff.
Again, I think that goes back to which, you know, happy to provide this afterward in terms of is that 594 number not being fixed.
Yeah.
Health staff
There,
may
and
just be
that's really
operating under
where-
the assumption that, hey, we're gonna change people's behaviors and therefore need to
But that
dispense
wasn't
fewer
quite what I
medications.
heard. I mean, in other words,
Right,
if you,
possible.
this is 283,000 between, the difference between these two, which is the big savings, right? That's where this 291
Right, the whole
comes.
savings comes in the labs
So,
and medication and health.
That's it, that's the big number. So,
Right, but I
so
guess,
did they bid apples to apples? Or did they bid,
Projection.
we are gonna, an actuary saying, okay, we're gonna reduce because we're gonna change people's behavior? And that, but I don't think that was what the request for proposal asked for, right?
On the pharmacy, they were given line by line.
Right.
So that you can say, and you could still argue, well, we're gonna reduce behavior or not, but you're given a line by line number, and then on the lab supplies, everything else, they're given a per visit number there. So that would be, I think, more of your actuarial.
Is that the same
example.
across the board? Care here did the same thing?
Correct. Every bidder was given the exact same information.
There's no question that Care here obviously has the best data because they've been doing it. But, okay.
Oh,
tell-
can I just, oh, sorry.
No, go
Last
ahead.
question, real quick, the $75,000 in telehealth savings, are the other companies, I don't know about that savings, that seems silly to me, I mean, I'm sure they'll get savings because they don't have to be in person, but whether or not we realize that, but I do want, does HealthStat provide telemedicine, cause most doctors do now?
They do not have it connected within their response to their EMR.
What does that mean?
So their
I don't know what
electronic
an EMR
medical
is.
record, so meaning.
Oh, electronic
so- yeah,
medical
so
records.
let me also, the 75,000, just to be clear as to how that was arrived, that was taken from a per head number as to what it would cost if you were to procure through Teladoc, we'll just use them, because they seem to be the most ubiquitous, so we'll use, what that would cost you if you said, hey, we want to buy Teladoc standalone and charge our members or employees $0 for the cost of that. It would actually probably be more, but that's how the $75,000 was arrived in terms of, so that's hard dollar cost avoidance, not, hey, people didn't go to urgent care, they called telemedicine. That wasn't baked into that.
Okay, so do the
that
other
number.
companies do? Like, do the doctors at HealthStat do telemedicine? I s-
Proactive MD did, HealthStat did during normal hours, but not off hours. So
Oh,
that's the
okay.
big difference, because right now you can actually do a televisit, with Care Here, but it's during normal hours. So this would be 24/7, that being the difference.
Okay.
So if someone, has to call at 8 o'clock.
And
9
you
o'clock.
called it Doc MD or whatever? You called it a program?
Theirs is called, I think it's, what's Care Here's program called?
Oh, so Care Here has their own program.
Correct.
Okay.
Would
I was-
that,
I didn't know if there was like an independent program.
would that increase the availability of appointments if it's now around the clock versus during office hours?
If someone was using it during office hours, it should increase the availability of appointments.
And does it count as an appointment that we were paying for?
No, you would not pay for that appointment. You would pay, well, to be fair, you don't pay for the appointments today, right? You pay for the salaries,
Service,
and then if someone uses gauze, you're paying,
Right.
you're paying for that, there. But we've asked them that they would need to classify that as a separate visit. They can't bake
So
that
there will be a
into.
charge for it.
Well, you're not charged for it.
There wouldn't be a
Today,
charge
there's
for
no
it. It
charge
would just
for
be
it.
accounted for separately, so we would know how many were actually visits and how many were virtual.
So if anything, we should see a decline in number of visits.
Should.
Correct.
Okay, thank you.
Can I just ask that same, I'm gonna ask the same question's been asked a couple of times, but maybe I'm thinking if we ask it differently,
Okay.
right? It's still the medication lab supplies. I just don't know that I'm clear on which one we're talking about. So both of these companies were given the same exact numbers. They ran their data, and this was the bottom line that came out.
So when they.
Wait, just yes or no?
So each one of the ones that came in to do an interview with us, they talked about their program and their approach and what they did, how they.
So it's
how
both.
they-
It's a
So
hypothetical. There's a
it's-
hypothetical
A lot of it is very
component.
hypothetical. They believe they could save a lot of money by cutting out
Right.
certain things and changing behaviors.
So
and-
if they don't, that
If they
savings
don't,
isn't
there's no savings.
realized.
Then there's no
But-
savings.
But,
Yes.
but again, what is odd to me, or just do the exercise, please, is for the visit, like if I came and I went to Care Here, Bill Mathias by himself, and I went and got medications, and it would be X number, how much would I have paid with Care Here, and how
Right.
much would I have paid with Health Staff? That should be straightforward, right? Because they submitted all the prices.
Yes, on the medications.
And if I need to go get blood work done, how much is Care Here and how much is Health Staff?
But that-
Simple as that.
But is that the number that's on this paper?
Again, on the medications, yes.
Yes.
That's what was provided. On the labs, syringe,
That's where we get
gauzes,
Okay.
that's lumped in.
Okay.
This hypothetical component is just so,
It's $1 million hypothetical.
we don't know.
I don't know that, I'm not hearing that it was hypothetical though. If they bid same lab and same medicine, those should be both hard numbers.
Yes, on the medicine, the labs, they weren't given Bill Mathias, XYZ.
But were they given
Prescription.
4,000 labs at a bulk
And
number?
yes.
And did Health Stat go 4,000 labs at a bulk number?
Were they coded, like medical coded?
No, they're given just as Chairman Mathias just mentioned, just how many labs and then what was the average cost per lab.
And so did Care Here say 4,000 and Health Stat say 200?
No.
I mean, is there that kind of disparity?
But
No.
did they lessen the amount that they would see because of their behaviors?
Instead of 4,000, was it 3,900?
Because they're gonna cut it.
No, I'm just throwing those numbers out.
Yeah, yeah,
No,
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 we
no,
are too,
no,
we're
it's
with you,
hypothetical.
we're with you
Maybe we could
here.
get a more detailed list.
But, yeah, so how many labs do they price? If Lab A cost, or if Care Here did 4,000 of them, did Health Stat say, well, based on our behaviors, we think we're only gonna need 3,900 of those?
Right.
And that's why it's less? Or did they price out the 4,000 and the labs are less?
Right.
Yeah,
That's my
That's
question.
all I'm asking.
That's
Yeah.
it, that's
Yeah.
the question.
let's itemize. I like it.
Or in the case of the labs where they bulked it, how many?
Yeah.
That's all. Okay.
Is that something you can do?
Yes. We have that.
We will come back with that information.
Okay.
Okay.
In the meantime, is it worthwhile for us to conduct our own employee survey?
I
And
think
say,
it
how
is.
important is this to you? I mean,
I
we always
think it
hear
would
from,
be.
the same handful of people who have had negative experiences at Care Here, and I don't know if that is the exception or the norm.
Right.
And,
Is that possible to do like a survey monkey thing? that we
like,
used to do?
I wanna know, how, are these people gonna be upset if we take away their doctor and
What
say?
is your priority?
Yeah,
Is it
yeah.
doctor or the fee or a good cost analysis?
I guess I
That's
guess
a
I'm
good
most
idea.
interested in what's their overall experience,
Yeah.
We can absolutely do a survey and provide you that information.
That'd be
When do we
wonderful.
have to make a decision on this?
If we're gonna make a change, we probably need to get that ball rolling pretty soon. If we are going to cut the program, obviously it has to be negotiated. If we're gonna make any major change to benefits, but if it's pretty much primarily just replacement management from one manager to the other, that probably would take a good 3 to 4 month process to get them changed.
I don't think we have any interest in cutting. I want you to hear that.
Okay.
Loud and clear. It's not a
I don't
cutting
have an
thing.
interest in that.
It is a,
It's an excellent recruiting tool for our teachers.
so we're really looking at $987,000 in management fee versus $916. That's kind of where I'm at. And they threw money towards doctors, which I think is the important part. And so the only part that's ambiguous to me is the 877 versus 594 in labs and prescriptions.
Right.
So,
We could get a telemedicine option with all of them.
you could do that separate from
Do
them.
that separately with some of them.
But
The advantage to the one that Care Here offers is it actually, like, if
Right,
you,
into their
if you call at
electronic.
night and you have to go in for a follow-up, they've already got all the records ready for you versus,
Separate.
is it possible that, because telemedicine was thrown in as an added benefit, so it wasn't in the request for proposal, right? Is it possible to ask Health Stat if they would do the same?
it's possible to ask them.
I guess I'd be interested in knowing.
Yeah, or what is their equivalent program? Like maybe they'll
Because everyone's
come up
gone
with,
this way, so.
yeah.
Is that, and how important is that for employees to have that option?
Right, like, do they need, like, what are carrier,
That's what I was-
carriers' hours? How late do they go at night?
Goes till 6.
I think it is.
I believe 6 o'clock.
So they-
Can we possibly see the questions, just so we ensure they're on there? So like, the one specific case that I'm thinking of is one case, and I realize that, like, we've kind of spoke about, but it was from somebody that I would absolutely trust, and the experience was awful. And that could be an anomaly. Everybody's had that bad experience one time. I just want to know, is it more the norm, or is it more the anomaly of the experience? So, and considering the questions that we're asking in the survey, I heard you guys say time, continuation of doctors, money, and then is
Gotcha.
this,
Yes.
say it again?
And how challenging is it to get an appointment?
Right. And then the overall experience was, I think in the case I'm thinking of, there were repeated tests run by Care Here, and then when they finally got to a specialist outside of Care Here, they had to redo all of the tests that they had already done at least twice with Care Here. Like, she was like, the money that you're wasting just on the test and the labs, which again, with medicine, that can happen, I think. We know that. So I just want to know if that's a normal, or is that something that was an anomaly?
I'd be cautious, I think, on the how hard is it to get an appointment question, and in terms of taking that into the decision filter, only because that's a function of how many centers do you have, right? What are the hours of operation? So meaning that I don't see being massively material depending upon who the provider is, right? If you operate between a certain amount of hours and you have a certain amount of people that want to access,
But we already established that Health Stat said they were adding more people. That's why their number went up. So that means more people means more appointments. It's as simple as that to me.
yeah, they're not, I could go back and do what the doc to doc number is. I think that's fair, but it's not, I don't see it making a material impact to appointment times there, because they're not gonna have 2 doctors, right, per location or 2.
Rather than just box it as doctors, I'd also
two
be interested in
professional
PAs
staff.
also. Because
Yeah,
PAs are
definitely.
just as good.
Yeah.
Or- I don't know. Okay.
That was fun.
I think we chewed this up enough.
Yeah. What, in terms of, and we can have it as a takeaway, in terms of the survey, I guess we'll work collectively with administration to get that out, because I think that would be something that would need to be happen relatively.
Quickly.
That's why I asked about it.
Sure, we'll do it.
And board members will see it, so that we're sure that we're asking the questions that are gonna get the answers that they need prior to it going out.
Yeah, if we could, I think that's important, so that we get
Are
it
we
one
doing
time.
it? Would this be our communications people?
Yeah,
Or
the district will put it out.
Yeah, we'll do it.
Okay. So-
We want to control this.
I think you still have a second half, is that right?
It may not be quite as,
Oh, wait, there's more on care.
There's more. They're not done.
All right, let's keep going.
Okay. So this is related to the life and disability pricing, and the next page is the EAP. So the process that I indicated earlier applied to both Onsite Clinic and life disability, so we don't need to go through that again. But if you look at the bottom right-hand side, so total, all in, savings of $255,000, and that's a combination between, board-paid life and the employee-paid disability and employee-paid life insurance. So I think it was the $87,000 was related to the board-paid life, and the rest is related to the disability. The coverage is the exact same, so there's no benefit differences going here, and in fact, additional value add for those who need coverage today that last year, the year before, didn't think they did, and maybe their health has changed, and now they don't have to answer questions there.
Okay,
Okay?
that was easy.
All right. So then the EAP proposal, so EAP was part of the response. Many of the vendors responded, or value add with EAP. Currently, the EAP is contracted separately through Aetna. We're also known as Resources for Living. You might know them as that. The reason why we have this grid set up this way is the EAP contract is actually a 7-1, but your life and disability is a 9-1, so there's a bit of an overlap listed there. You currently receive up to, or employees do, up to 5 visits per issue with Aetna, but the standard it will be up to 6, so there is an additional benefit, which I think, given where we are as a country with mental health, that we can all agree having an extra visit is good value on that side. The reason why we put this overlap in here is it's certainly possible, and we are unable in terms of availability of data and what we're able to get released to determine that, someone might be seeing a provider with Aetna who may not be within the network, within the standard. And what we don't want to have is someone who's on visit 2 of their 5, and then now they have to switch and kind of rehash their, whatever, their challenge or what they're going through. So we've taken, in our view, I think, a very conservative approach to solve for this. And you'll see, first, if you stay with Aetna, even there's a little bit of savings, and you'll notice we're truing it up through August, so we're comparing, apples to apples here. We're indicating that if you go month to month with Aetna from July through the end of November, and the reason for that is the standards contract doesn't start until September, so someone starts services in August, and then we have to tell them, hey, you have to redo it. We want to give enough time that they can, in the event their provider's not with the standard, they could run that out, with Aetna. So we've added both of those up, and really the big difference, just keeping similar lens to the discussion we just went through, is the standard's able to leverage the life and disability premium for much lower EAP costs. So that's why they're able to do it at such a reduced rate, whereas the Aetna, it's a standalone contract, and that's all they're providing.
So my biggest question on this one was the network of providers that are out there. In terms of availability of numbers of providers, is that about the same? Or
Yes, so we did an access report there within the area, and there's provider access is adequate, so we don't see any issues there. But that said, you could be with one provider,
Right.
and there's no way for us to do that difference.
I was nervous that maybe Aetna's got 100 providers in this 10-mile radius, and Standard might only have 1.
No, it's
And-
really, we see this which it presented a unique, ability because of life and disability RFP for us to pair it with that premium. The stark difference in pricing is typically what we see standalone versus paired with the actual insurance premium.
Next.
Okay.
I think we covered the question.
So next was just more to follow, on page 11. Just some areas that we're looking at, and I think some of this maybe hits on what Ms. Cronin touched on, and, if there's areas where we can have a double savings, is save the district money, save employees money. We're investigating, several areas, and some of these we put into place with our current clients as to, how do we align interests? Meaning if we can get a better deal direct with a specific provider group or a separate network, so we'll take surgeries. For example, musculoskeletal claims are, with any employer, really top 3. It's really cancer, musculoskeletal, and then the third, is a bit variable. If we can, negotiate, a better deal with a surgical network, and there's ones out there, that say the carriers will offer. I'm near with Blue Cross, but I'd say the same as if you were United or Cigna. What we've done with some employers is incentivizing the employees. Hey, we'll reduce your cost share if you go here, and great, because we save money, because we're saving 30% on the surgery, and the employee's happy because they didn't have to pay whatever their copay was. So there's some, I would say, aligned interests, ideas that we're investigating, so more to follow on that. This was just a sneak peek.
More to follow, like when? Because that seems like a really good idea.
Yeah.
More to follow with the committee. This was just something that we're doing a good bit of, and wanted to have a conversation with you all, so you know what we're thinking
That
of,
is
and
brilliant.
being forward thinking, that we're out there. We've already done several things, on the pharmacy, some of these other RFPs, and we think that there's still room to sharpen the saw, and if both parties can win, then all the better.
Right, very good.
Any other questions for Josh?
Very kind. Thank you very much. Next.
Just want to give a real quick, I can't find it. Hold on just 1 second. Real quick update on,
A refund.
sorry.
Fun name.
So this is just our health insurance fund. Why is it not sharing? Okay.
Is it sharing the wrong screen?
Oh, it disconnected me, sorry. Just a second. Fun stuff. Sorry, I lost connectivity for just a second. I got it coming back on now. Okay. So just want to real briefly share with you the health insurance fund. As you recall, a couple years ago, we had zero fund balance in our health insurance fund, and we made it a priority to properly fund that with some good, sound fiscal policy to increase premium contributions from the board. We did not increase anything for the employee, just the board portion. And if you recall, it was a 2-year plan to replenish it up to the minimum required by the state, which is 60 days. The pandemic hit, which had actually the opposite impact of what you would think. A lot of people stopped going to the doctors. There were a lot of surgeries that had been postponed. So we actually got within the 60 days within the first year. Board had already approved the contribution. We felt like that there was potential for a larger increase because a lot of those surgeries were postponed, and we felt like that this year actually we would see those surgeries along with the new surgeries. We didn't really see that much of an increase so far this year. It has increased, but it's been more like the normal medical trend and not a big, huge bubble. So if you look at last year at the end of 1920, we actually had 79 days of claims history built up. And right now, for the end of 2020-21, we're looking at about 116 days. So obviously, our health fund is very healthy, which is a good thing. You know, a lot of that is, like Kim said earlier, you know, we've made some plan changes. We've watched a lot of things. We've negotiated lower prices, and obviously the board contribution helped also. So the committee, insurance committee met. We talked about. I didn't have numbers at the time, but we did talk about the very healthy fund balance in there, and we voted to recommend no changes to the employee cost of the insurance for the upcoming year. So that's not up for vote for you guys because it's not a change. So we're not recommending any changes to increase for the employees. So I just wanted to cover that with you real fast. Any questions on that before I go?
Great.
Okay. All right. So I think we're at the next part, which is our COPS reissue or our refunding. And today we have Jay Glover with PFM. He is part of the team that is our financial advisors who advise us on how to maintain the long-term bond financing in our district. So with that, I'll turn that over to Jay. Jay, give me a second and I'll share your presentation.
Perfect. Chairman, School Board Member, Superintendent Jay Glover from PFM Financial Advisors LLC, and we are the district's financial advisor on debt-related matters. As part of that job, we continue to review the district's debt portfolio looking for refunding opportunities, and we're here today to present one to you that can save significant money. I think you have the presentations on the screen there in front of you.
There, yeah.
Great. The first page, if you want to slip to the next page, I just want to start off giving a brief overview snapshot of the district's current COPS debt portfolio. So you can see here, the colored bars show your annual lease payments on your outstanding certificates of participation. So they're just shy of $20 million. And the good news is that the district doesn't issue any new money debt. All of the district's debt will be paid off in 10 years. So in 2031, all of your debt would be gone. We also show a red line, which is your 1.5 mils of capital outlay millage, which generates about $40 million, assuming 96% collection. So you have a very conservative debt portfolio. You're using less than half of your capital outlay millage to make lease payments. That leaves you significant underfunding to pay-as-you-go type projects and other transfers you might make to the general fund. So the bottom table also shows just your various call dates on your debt to the far right column. And as we get close to those call dates, that's when you potentially have a refunding opportunity if interest rates are at the appropriate level. Because most new debt that's issued has a 10-year non-call provision. So as we get close to that call mark, which we're doing with a few of your transactions, we can hopefully save some money.
Could we go back to that chart just real quick? I'm confused. You said by 2031 we would be out of debt, but I'm seeing the blue bar at 2031 says Series 2015B. Isn't that one of our debts?
Yeah, so that is the final payment. That big blue bar is the final payment on your 2015B transaction. Once you make that payment, you would have no debt outstanding after that.
Oh, okay. Now I
Yeah,
get
so
it.
these are the annual payments. The
Got it.
2031 deal had a large last maturity, so once that's paid off, all your debt's gone.
Thank you.
On pages 3 and 4, we just provide the statistics on 3 of the transactions that we think you can refund now for significant debt service savings, and that's your 2012A and your 2012B COPS, which are outlined on this page. You can see some key statistics. Most importantly, they currently have interest rates as high as 5%, and they're callable June 1 of 2022 without a penalty. The 2012B certificates also have interest rates as high as 5%, and they're also callable June 1 of 2022. So we're really getting close to being within 1 year of the call date, so it's a very attractive time to potentially refund those COPS. On page 4, the other transaction we're looking at are your 2014 certificates of participation. Again here, interest rates as high as 5%. And those bonds aren't callable till June 1 of 2024, but we still think there's a refunding opportunity, really because we're at historically low interest rates. I mean, I think everybody's aware of what's been going on in the markets. I will say rates have probably trickled up over the last month or so, but historically speaking, they're still, I mean, at absolute low levels. So it's a great time to be looking at refinancing any debt you have under these circumstances. There's one little caveat, and this gets a little bit in the weeds of things. When the tax law changes were put into place under the prior administration, they got rid of what are called tax-exempt advance refunding. So you can no longer issue tax-exempt debt to refund a transaction before the call date. So once you get within 90 days of a transaction's call date, that's what we call the current call window. So you have to be within that 90-day window to do a tax-exempt refunding. However, since interest rates are so low, we're actually able to issue taxable debt today to advance refund these transactions and save significant money. And then there's another benefit. We can actually enter into an exchange agreement also today, or when we close the transaction, that will allow you to exchange or convert that taxable debt to a tax-exempt transaction when you get within that current call window. So just kind of big picture speaking, we're able to lock in a very attractive taxable interest rate today under current tax law, but also lock in the tax-exempt rate that we will exchange those bonds for when we get within that 90-day call window. So you're really getting the benefit of both worlds. We're able to lock in rates today, and we're able to stay within all of the tax law requirements the IRS requires. So that's really the kind of the one caveat of the transaction we're looking to do today. And if you switch to page 5, in order to move forward with this transaction, PFM recommended that we do this exchange type bond because, again, we can do taxable today and also lock in tax exempt rates within the IRS requirements. We went out with a request for interest rate indications to groups of local, national, regional financial institutions to see who would be willing to do this. And we actually got 7 proposals back of firms that were willing to do these transactions. And you can see in the third bullet they're listed here, Bank of America, Capital One, JP Morgan, PNC Bank, Raymond James, Truist, which is the new SunTrust BB&T merged firms, and Wells Fargo. We discussed this with your bond counsel, your finance staff, and determined that Truist Bank provided the best option for each of these refundings. And you can see here in the fourth bullet, Truist, there's going to be 2 specific transactions we're recommending. One would be to refund the 2012A and 2012B bonds because they have the same call date of June 1, 2022. So we're able to lock in a 1.69% taxable interest rate in today's market. On the 2014 transaction, which again is callable June 1, 2024, so it has to be a separate transaction because of this different call date, we're able to lock in a 1.79% interest rate. And one other key element of the Truist proposal that was different than some of your other proposals is they are willing to hold that interest rate through a closing date of May 18th of 2021. So if we're given direction today to move forward with those transactions, we would come back to you at a later date, which we'll talk about, for approval of bond and leasing corp resolutions. And there's time to put all that procedure in place. So with Truist, they're willing to hold those rates. So if rates continue to trickle up over the next month or so, that risk is with the bank and not with the district. Same thing, if rates do happen to go down, obviously you would not see the benefit of that. But given these historically low interest rates and the volatility in the market, we thought having those locked interest rates was a favorable feature to their proposal. Again, the other element of this, we would enter into 2 exchange agreements which would lock in today tax-exempt interest rates that would allow us to exchange those taxable COPs for tax-exempt COPs when we get within 90 days of the call date. So again, I know I'm kind of in the weeds here, but I'll get to the good numbers here in a second. The 2012 AB refunding, the 169 taxable interest rate would be exchanged for a 1.34% tax-exempt interest rate, and then that would be the rate until final maturity of the transaction. On the 2014, again, locking in taxable 179 that would be converted 90 days before June 1 of 2024 to a 1.41% interest rate. And again, that tax exempt rate would be locked through final maturity of the transaction. And what does all this mean in terms of debt service savings? So the minute we lock in those two taxable interest rates, we'll lock in almost $5 million of net present value debt service savings. That will be locked in on day one, and nothing will happen that can change that. Assuming we do exchange the taxable COPS for tax-exempt COPS on each of those respective call dates, your savings would be increased to over $6.1 million on a net present value debt service basis. So significant savings by locking in these two transactions, which can be shown kind of graphically or in a table on the next page. The key line here or column is labeled savings. This shows the current debt service on the COPS we're anticipating refunding, and then the new debt service after the conversions happen. So you can see here, we're going to be lowering your annual lease payments around $800,000 through 2027, and then $630,000 in 2028, and almost $500,000 in 2029 and 2030. And one thing I will point out, we are not extending the maturity of either of these transactions. We are taking the savings over the existing life of the transaction. So there's no extension of maturity. All the cost of issuance to do this type of financing are included in all these savings numbers. So if all goes as planned, you would lock in over $6.5 million of annual cash flow savings, which again is about $6.1 million on a net present value debt service basis. So again, significant savings levels that we would recommend we move forward with trying to achieve. Assuming you all agree with that recommendation, slide 7 has the next steps that would be involved. Over the next couple of weeks, your special tax counsel / bond counsel, who is Greenberg Traurig, would work with your school board attorney to draft and prepare a school board resolution as well as leasing corporations resolutions that would be brought back before you all for consideration at the May 10th school board meeting. That would give us plenty of time to hopefully get those resolutions approved, and then we would sign all of the financing documents and look to close the transaction before the May 18th date, which again is the date that Truist will hold their interest rates through. So I think everything is ready to go. We're just looking from some direction from you all as to whether you want to pursue these opportunities. And if so, we'll kind of go our way and get the work done and then bring it back before you at, again, that May 10th school board meeting.
Very good presentation. Thank you. Board members, any comments?
I have a couple questions. So you said all these fees, and that makes sense that they're all folded in. So we're switching them to taxable COPS. So when we then switch them to non-taxable, is there a tax that has to be paid then?
No, so really the tax status is more so on the investor side. So the interest that the bank will receive as a taxable transaction, they have to pay taxes on that.
Okay.
So Truist is the one that deals with that. So, and then when they're exchanged, they're no longer paying taxes on the interest they accrue. Therefore, they can give you a lower interest rate. So all the tax status is really on the investor or the lender's side.
Okay. Okay. And then any fees would that's all figured in.
Yeah,
so at that
we have
point-
very conservatively estimated fees within the numbers we've provided, and we think they'll actually come in a little bit lower. But each of the professionals that is involved in this transaction has ongoing contracts with the school board, which that outlines what the various fees for the transaction are.
So even if if taxes on this type of COP goes up, we're locked in, right? Yes? No?
Yeah, there's nothing, if the corporate tax law changes or anything changes, it doesn't impact this transaction. The one caveat I will mention is if for some reason we get to the exchange date and your special tax counsel, your bond counsel, who's Greenberg Traurig, cannot provide a tax exempt opinion, then the transaction would just stay in the taxable mode and the exchange would never happen. Probably very remote, But at that point, again, you're still saving the $5 million of net present value debt service savings. You're just not going to get that extra $1 million. The thought there is if something happens in DC and they just do away with tax exemption for local governments, then your council cannot give you opinion that you can exchange that to be tax exempt. That's really the only thing that would happen.
Okay.
And I mean, to me, that's a very remote possibility, but we do like to point that out. So we only do these transactions if they make sense on the pure taxable basis, and this one very much does so. Getting the tax exempt exchange is sort of like gravy on top, so to speak. It's an extra $1 million, which we do want to take advantage of and likely will be able to. But even if this remote chance that we can't, it's still a great transaction.
Thank you. I'm good.
I think we're all good. Great presentation.
Thank you.
Thank you for bringing that savings, Mr. Ward, to us.
Yes, sir.
Well
And,
done.
and again, this is capital outlay funding, so, you know, this will allow us to use our capital outlay funding for other pressing needs. So we do appreciate the opportunity to refund that.
Yep, well done. Thank you very much. Okay. Then we have construction contract with Mr. Mock. Let's take a 5-minute break while y'all set up. Okay, welcome back. We now have Mr. Mock and
Mr.
you'll introduce
Brolin.
your guests.
Yes.
So go for it.
Thank you.
You got 5 minutes.
Great. My normal. Internal audit, with the help of Cars, Riggs, and Ingram, completed a construction contract review. The objectives of this review was to look at the school district's risk in construction, enhance cost avoidance, and facilitate cost recovery. All the things I've talked about in the past when I've done construction audits for the school district. As pointed out, Mr. Rob Brolin, partner with Cars, Riggs, and Ingram, is here today. He and his team completed this review for the school district, and I will turn it over to Mr. Brolin to go through what they found.
Good morning. Thank you for the opportunity to be here. So just this first page is really just kind of our cover letter outlining what's in your packet. Obviously, it's large because we gave you the entire contract, so you can see all the marked changes. I'm not going to go through those. I'll be happy to answer questions at that detail level, but I'm going to stay at the summary level. So we did give you, Mr. Mock outlined a little bit about the objective, scope, and approach, which is on the next page. We gave you an executive summary, then we gave you some attachments with respect to this package. So I'm going to go ahead and go down to the next page. And then the last two paragraphs, that's just telling you what we're not doing, what we are doing. And so it's really a consulting type project, so we're not giving an opinion on anything. So Mr. Mock summarized the objectives. I would sort of summarize it this way: is we're coming in and looking at your contract and saying, well, how can we improve the contract to reduce your risk? To make sure you're not charged for things you didn't expect to be charged for. Because anytime you deal, this is a cost plus contract, a cost reimbursable contract. So just like it sounds, they're going to get reimbursed for everything they can support. So you don't want that to be a blank check. And the contract was a good contract. We just felt there could be enhancements to make it better. And so I always tell people, what I always tell people is it's not usually what's in the contract that opens you up to potential issues. It's what's not there, right? Because you want to be very specific. If you don't say, don't charge me for X, and it's project related, guess what? They can charge you for X, even though you might say, wait a minute, I wasn't expecting that. I wasn't expecting to have 10 trucks on site, a truck for every person. Well, we need to specify that. Or another example is like labor burden. So, well, what goes into labor burden? Well, you talk to different contractors, they're going to tell you there's certain things they always put in there. Okay? Well, you might say, I don't want to pay for your training and your uniforms. Okay? So we go in there and we specify a clear, specific definition of what you can put in there. And then on top of that, you might decide, well, just because you have a labor burden of 65% doesn't mean you want to pay for that. So what we do there is say, okay, we're gonna propose a threshold, put a cap on that. Don't exceed 35 or 40%, and kind of work with management. There's negotiation with that in that range, but anything above that, in our experience, we're saying is not reasonable. And so we recommend to management that they cap it.
Excuse me, as I'm looking at the color code, who is blue and green? in this document.
Right, so there's a little legend at the top, that first paragraph. Let me get this thing, I guess.
Oh, there's a legend?
Well, it gives you, tells you who's what in that first paragraph.
Up here.
Yeah, I'm on this page
Oh,
now.
yeah.
So you can look at that, the first paragraph after the dates, the date of the revisions.
Oh, key.
Yeah, key. I said legend. I should have said key.
I know.
Sorry, you're looking
They're
for
the
a
same
legend.
thing.
It's a key, yes,
It's
thank
fine.
you. And so basically, the black is our original is,
Last sentence.
right, and then so you'll have in there,
Oh, got it.
and you'll have the initial, when the
Thank you.
attorney, and always have the attorney's initials in there. So ETJ is Elizabeth's initials there, and then you'll have, the different colors for, the key as far as who's responding. So the black is the initial, actually, I'm gonna back up. Obviously, our observation is in the left column. That's where our observations are. And then we have the response, which is either gonna be management or the attorney, or both. And then our red then becomes the kind of the final response, our response, and then we're able to close that. And you'll see every one of these in that column to the right, we've gone through and closed every one of those items.
So if they're closed, they're not of concern anymore?
No, that just means that the observation was implemented as described in the right column. So sometimes 98% of the time, thereabouts, what we recommended as an observation, management accepted, and that was what was actually put into the contract.
Okay.
Yeah, so closed means it's been resolved. You can tell in the comment, sometimes there's just a few occasions where they said, and one deals with the design percentages about, what they wanted to look in terms of design percentage. That was one in which they said, we like to stick with the original one, and we said, okay, that's fine.
Okay, cool.
So just here again are just some more examples, again, at a high level, and again, take any detailed questions you guys would like, or any questions you have. So these are these 10 examples here on this page, on page 2. I named one, I talked about the labor burden, but these are kind of the top 10 things that are very typical that we identify and want to make sure that are always in the contract to protect, again, to protect the district of unwanted or unwarranted charges. Another way of saying it is, you're doing a cost plus with a GMP, which means you have an overall cap on it, right? A guaranteed maximum price, and as you understand, it only can exceed that with properly authorized and approved change orders. Oh, so within that, though, the challenge is to make sure the contract has all the economic clauses needed to make sure at the end of the day, there's only one profit center, the one you negotiated, right? That percentage. Everything else, there shouldn't be any markup. Everything else should be at cost and should be well defined. So it's all those costs are all costs that you have agreed to, and you have reasonable language in there to make sure they're reasonable, and you have, like I say, necessary caps to avoid any excessive charges for the district. So I'll pause there. Like I said, I don't want to go into the weeds unless you have all the details in the contract itself. But those are the nature. That was the process. Also to point out, we went through and proposed our changes. There was the process. Then management and then the outside counsel looked at those changes and went through all of them. So I want to emphasize it was a very well-oiled collaborative process, which I think was really good. Us working together with management, with the attorney. So at the end of the day, closed is good. That means we all got to an accord. We all agreed on those changes.
Great.
So is there any, I see that there were issues and they were addressed. Is there any problems still, or remaining that we need to know about or handle?
No.
I'm not seeing anything that's
No,
closed.
no,
Okay.
no outstanding matters to address.
Okay.
Correct.
Very good. It was 5 minutes.
And the idea is to take these forward into future contracts. This was a
That's what I
contract
understand. You went back
already.
empirically and looked at it.
Right.
Yeah,
So
this
what we had
contract
done,
reviewed was already
move forward.
formally completed,
Right.
so it couldn't be changed. But the idea was to take these forward into any future contracts, which we're currently working on.
Right, so
correct?
just, for example, so what I tell people too is this has annuity value, right? You get this contract the way you want it, and then you're gonna cost avoidance, right? You're going to continue to get savings, you're going to continue to not have to get charged for things that if it didn't address those now, it would continue on.
I think it's excellent.
And we're moving forward, our business relationship, he will be looking at the payouts and the closing documents. So we brought this to an outside professional, and so we look forward to hearing from you again.
Yes, yes.
Very
And
good.
just one other thing in process, so just to Mr. Mock's point, so we're currently working with facilities directly to, because it's a different contract now, they're doing instead of doing a design build, which changes up what you put in a contract, which they've been doing, now they're doing a construction manager at risk contract. So I've been working with them, in fact, we're just working on the finishing touches of that one related to the
Aurelia Cole.
the really cool project. So that one is actually, we're up, now we're in front of that one, ahead
Right.
of that one. So in that contract, and it'll bring a lot of the same cost component terms. Those are very much the same, but there are other changes need to be made to convert it from a design build to a construction at risk, which again, working directly with facilities management on that.
Well done.
So if these had been in place for the last contract, what sort of cost avoidance would we have likely seen from that?
Yeah, that's difficult to estimate. The really way to know that would be to do the closeout for that project. Once you do the closeout, then we'll be looking at those things and we can see. So I don't know, for example,
So towards the end of the year, you might know this one, the
Yeah.
answer to that question. He can't answer it in advance.
Right.
But after they close this one out, which will probably be October, November
I think that's
timeframe.
what we said, right?
So
That's-
you'll bring that number back to us and let us know what, I guess I'm interested in knowing what sort of cost avoidance we get on future contracts.
Or we
Is it
could-
$1 or is it $1 million?
But let's don't over-exaggerate that.
Yeah.
There may be none.
Yeah, there may be none.
Right.
It
This
just-
is
it
just
really-
tightening language
Yeah,
up.
it really depends, and you have to look at that closeout and see what were things actually, so where we
Okay.
adjust the contract language, sometimes it's very quantifiable. So for example, if they used, labor burden of X dollars, and then later they did something else, and we could just do the math on that one,
Right.
right?
Mhm.
Other times it might not be quantifiable, because you don't know, because part of it is a deterrent, right? Once you put that language in there, then you've already avoided those things, and sometimes you can't necessarily quantify all that you've avoided. You just know you avoided that. So,
Okay.
yeah, but we'll know more at the close.
Very good. Thank you very much.
Thank you.
Great, thank you.
Okay, we're going to move into alternative education program.
Oh, yay, I'm glad we got to that. Yes. Deeply interested.
Superintendent?
Or packet. Okay.
I don't think we have one.
I was gonna look and see if there's something online. I think
So the last item on the agenda is actually a two-part presentation. We're actually going to start with, I had asked Ms. Pearson to share with the board our summer learning opportunities that we met with our principals last week and went over with them. It's pretty exciting to see all of the great services that we're going to be providing this summer, and I knew that you all would be interested in knowing about those services. So we're going to start with that, and then we're going to move into a presentation by these ladies as well, and we'll have a few guest appearances by Mr. Ward and Dr. Landry as well. This has been certainly a group effort as we have been considering an alternative education program for our students. So I'll let Ms. Pearson start with our summer program first.
Good morning. It's still morning, so we're the last on docket today. Very happy to be able to bring to you this presentation. If you'll give us the next slide, please. We have a lot of summer learning that's getting ready to take place this summer. Usually we have summer reading camp and VPK, but we've really expanded, and ESY, we've really expanded our services this year to be able to offer some additional opportunities to close some gaps with our students. So what we have up here is all the programs that we'll be offering. We'll continue our VPK program. We're actually going to expand into a kindergarten readiness to have some of our existing kindergartners that may have some additional support that they need to stay, but we're also going to be looking at some of the students that maybe decided to skip kindergarten this year and want to get an early start. So we want to provide them an opportunity to also join us. We will continue third grade reading camp for our students that need that support. And then summer learning, we've just called that every other grade level, pretty much. If you have any other grade level and you have students that need support, there will be summer learning opportunities that schools will be able to provide to those students as well. ELL, so our students that are English language learners, they will also have some support during the summer through our summer learning. We continue ESY, which is our students that are Exceptional Students Education Program, and they will be joining us. And then our ELCs will be open, and we are actually looking at providing additional incentive opportunity for students that are already in the summer program to be able to stay on and participate in ELC. We offer course and credit recovery in the middle and high schools, students that might need to complete a particular credit so that they can be promoted or a course to continue, and then seniors that need some summer support as well. So that's a lot going on, much more than usual. Next slide, please. These are the sites that you see on the far left. So we've picked certain sites in each region, an elementary site, middle school site, and a high school site. We work with transportation, so as students become registered, we'll be able to create those routes. That's why we're planning early, because we expect many students to take advantage of this opportunity. So we'll have busing that is available for all the students to be able to get to the sites. And these are the programs from the previous slide. Each school will have different program offerings. So all of the elementary schools will have VPK and the camp, but at Rhymes we will have the kindergarten readiness as well as the ESY, but of course not the third grade camp because they're early learning center. In our middle and high schools, we will still offer the course credit recovery, support the seniors at the high schools, but then any of the students based on their data, they can look at the multiple grade levels and decide how they want to provide those offerings. The initial projection are the number of students that can be served, but you see the plus next to that because as more and more register, we'll just add on some more teachers to be able to fit the need. It's pretty much a starting place. So where we're starting at is providing 1,300 or so slots to students over the summer, but we do think that will increase, and we've held some funding accordingly. You can also see that the ELC scholarships will be made available. We've used some of the, projecting some of the ESSER funds to be able to provide that support to parents so that they can have their students there all day. We'll also have additional site and a site administrator that can be over some of these programs because we do have some schools projected to be more than 250, 300 kids might be on their campus. We also will have teacher assistants provided to support, just as we did in our regular day school, and nurses. We're going to close that week of July 5th through 8th. We think families usually take time, so teachers also want to take time because we have teachers that are committing now to hang on in the summer, so we want to provide that opportunity. But it's a full-month program, June 21st to July 22nd. Next slide. One other thing that we're excited about is that we are going to provide some additional enrichment to students. This is new. And through our work through restorative practices, our past teachers, and our school administrators, we've been able to hear from students. And one thing they say is that they also like to have some enrichment during the summer. So we're going to provide some enrichment programming, which is in the form of student voice advisors, which would be teachers that we hire to spend 1 week at each of the sites and then kind of spiral through the rest. So you might have 1 week of art, then another week of music, another week of dance, and your last week might be something in finance or communication. So we want to provide a little tiny enrichment block so students can be there and also get enrichment as they're getting their academic needs supported. So that's pretty much our summer for right now. Stay tuned. It keeps growing.
Great.
Okay. Any questions?
I was just curious about the locations. How did you, about the Leesburg look? Can you go back to
Sure.
the slide with the location?
You'll go back to, right there.
So for like elementary, do we need something in the Leesburg area, or for like the third grade and there is ESY?
Yeah.
Or do we have enough because we have Beverly Shores and Leesburg? Is that
Yeah,
what the
Tavares
decision
is
was?
the site for Region 2, and we wanted to kind of lift some of that off of Leesburg Elementary and Beverly Shores that do it every year. The students will still be attending, and because we have transportation, we felt like we could still run it at Tavares. They're going to have a lot of people they're hiring and onboarding, but if we do have a lot of students from the area, we can revisit it. Like we're still very early in time with numbers, but Tavares would be their site.
And we are providing transportation?
Yes,
Okay,
because
which
we are providing
I missed
transportation.
that part. That's
Yes.
fine.
Yes, ma'am.
Thank you.
So these are not the ELC sites, or these are in addition to ELC sites?
Those are also ELC sites,
Are
and
there
there's
other-
additional, yes, there's more.
Other ELC sites in addition to these?
Yes.
Okay.
There's several other, but they will also be at these sites, so
Yeah,
that
on
kids
the
can just,
Location side, it kind of piqued my interest that I saw the only elementary was Groveland, which is not right around the corner for everybody in Claremont, but.
yeah, no, there's
for the
other
size of the
ELC sites
population.
in the south. I can't remember offhand, I think it's Lost Lake, and I can't remember, but we do have a list. Ms. Dylan Banks and Julie Summerlin have been working on that.
Have we typically provided the transportation in the past for these programs?
I'm sorry, I didn't
Have
hear.
we typically provided the transportation in the past?
No. Now, last year
What's the
we
name?
did, when we got GEARS funding, because transportation was included, we provide transportation for summer reading camp. And then if we have additional seats, we would, if we had any other summer offerings, we used to have kids like be able to get on the seats for those. But for the most part, we've never had a program this big. So it's only been pretty much third grade that we've transported. So this is a huge undertaking with regard to making sure that we're getting all the kids everywhere during the summer.
Yeah, I do like that we're removing that barrier for folks.
Mm-hmm.
Particularly if students end at 1 o'clock, that's just, not every parent's off for summer break too. They're all still working.
Absolutely.
And, so I don't know how you get the kids otherwise. So thinking about 265 kids coming from all over a region, is that, I guess I'm wondering about the efficiency of that. Do we have a lot of buses doing that, or are you going to have bus
Well,
stops? close by, or
transportation has assured
what
us
does that
that
look like?
they will do whatever we need to make
Yeah.
sure that we get these routes going. And like I said, we're looking at numbers first, how many people actually are committing to do this. Like, because, that's why we ran it early. Some parents may say, yes, I can't wait to have some more time. Some kids might say, please, I don't want any more time, right?
That's right.
So we want to see how our numbers look. We're actually ending some of the registration in mid-May just to see where we are, and then have some more slots for maybe the end of the year if there's any kids that fall into a situation where they need it absolutely for promotion. So once we get numbers, it may get bigger, it might get smaller, we'll see. Also want to make sure our teachers want to do this, right? So we need to make sure that it matches the need that we have teachers that are committed to be able to stay one more month in the summer knowing you're not really going to get a lot of break before you start up again. So I'm sure we will. Our teachers are always there to make sure that we do what's best for our kids.
I'm sure you've thought of this, and historically, this is the way we've done it. But have we put in an added component such that these schools that are the sites, they're gonna get some additional, I think I see Mr. Carr in the back, they're gonna get some additional custodial help?
Yes.
To bring their buildings up to par before school starts?
Yes, I did include that in the grant, so they'll get a warehouse order. They have funding for that to buy supplies for students as well as supplies for the school, like your
Wax.
toilet paper, your paper towels, all of those things. So we did include that.
Good deal. I think it's an excellent proposal. It looks like you thought of everything.
I hope so. We still have a little bit of time, so if you think of anything, we're always open. There's a lot of departments working together with this, so we're trying to make sure that we have everything handled. But we have time before summer here.
Very good.
Okay. If you'll give us the next slide, please, and the next one. So now I'm here to come before you again with another proposal in terms of an alternative school. Next slide, please. Currently, we have therapeutic services provided through our contract with LifeStream in an alternative school setting. And so we have students that are receiving therapeutic services, intensive therapeutic services, and that is how we contract normally with LifeStream over the past. So if you give us the next slide, what we would like to do, our goal is to improve our educational and mental health services by offering this program in our own school setting. So I came before you probably about 2 years ago with regard to Lake Success Academy, and we're here again to bring in our students that have been receiving therapeutic services through a partnership back to us and service them through their academic needs. We do believe that we, as the educational entity, can provide very good, high-quality academic rigor with regard to our students, and we think that we can also provide the intensive therapeutic supports through some support still with LifeStream, because that is what they do well as an entity. They provide therapeutic supports, and we provide academic rigor. So together, this partnership will be wonderful. Next slide. So we're going to expand those services, and we believe we can do it in a pre-K through 12 environment. The school would also get an improvement rating similar to what Lake Success Academy also receives. Next slide. And we're looking at 3 different sites, trying to figure out what might be best. Lake Hills, already we have services provided there. They have a lot of staff that offer some of the things that would be needed to support these students. So we're looking at expanding Lake Hills and maybe providing some opportunity for slots to be at that particular school and make that an expanded program. We're looking at roughly around 120 students, and we think maybe half could be I guess, taken in at this particular site to be part of that program. So the other half, we look at maybe these other 2 sites as options. Mascot Elementary, our school, not the charter, but our old Mascot facility, can be renovated. We have worked with facilities to take a look at that, where possibly another 60 students could be provided their support there. So we would kind of have maybe half at Lake Hills and in that program, and then a satellite Lake Hills setting in the south. Other opportunity could be Eustis.
Sorry, but did you say at the charter or not at the charter?
Not at the charter. So
Okay, I
before we,
misheard.
our
Okay.
old,
It's right now at
yes.
IT.
No, I'm not
Okay.
taking over their charter.
Yeah, I was like.
But it's our old facility before they had their new charter school, so we still have that site. And the other option could be the existing LifeStreams facility in Eustis. So that is a northern site. We're getting that building appraised, to my understanding, and looking at maybe taking over that as another opportunity. So we're working there to figure out the best fits to support the needs of these 120 students. Next slide. Proposed staffing, and this varies based on location. Like I said earlier, if we do put half of our students at Lake Hills, it provides an additional opportunity to decrease some of the staffing because they already have staffing and we're just absorbing students into the existing program with a little bit of support. If we operate 2 independent sites, this is pretty much the staffing that we would need for independent site staffings to begin to open the school. You see on the administrative end, either a 0.5 or administrative coordinator, meaning if we do a Lake Hills site with another site, it could be 1 principal split across 2 entities. If we did the other 2 sites without incorporating Lake Hills, then it might be an administrative coordinator split across those 2 sites. So for the most part, this is the site selection based on the staffing that would be needed to run 2 independent programs. It would decrease if we collapsed into the Lake Hills. Okay, next slide. Action plan. So I have Miss Melissa here, Lyford. She's been working within her department to really look at what does it mean to take on this responsibility, and she's been planning some of the academic experiences as well as the therapeutic supports. But we've also worked with facilities to really take a good look at the sites to make sure that they're able to be supported through the needs of these students, and they've been working to help get that ready. And then we have some other additional meetings set up to ensure for security and transportation, food services, finance, technology, and all those little things that go into starting a school as well. Next slide. And so I'm going to pass over this next portion to Ms. Lyford so that she can share her vision for some of those academic pieces.
Good morning. I'm pleased to be able to share some of the details about the services and supports that would be provided at our therapeutic sites. Next slide, please. And as Ms. Pearson mentioned, one of the proposals would be an expansion of Lake Hills School. So to distinguish between the services and supports that are already provided at Lake Hills, we would talk about our therapeutic program in terms of the academy at Lake Hills, just so we can distinguish between the 2. Ms. Pearson also mentioned that we're looking at serving up to 120 students, pre-K through 12, at the 2 sites, but 120 total. And those students, the enrollment throughout the year would fluctuate. So based on individual students' needs, the enrollment at a therapeutic site would vary. And then, of course, students will be instructed in a traditional classroom with a ratio of 1 adult to every 3 students. So there would be 1 teacher and 2 paraprofessionals in each of the classrooms. And those adults would be trained to provide those intensive supports that are needed by students who have emotional, behavioral, and mental health needs. And of course, they would also be able to provide that high level of academic support with that low teacher to student ratio. Next slide. So with our therapeutic supports and services, the program will be designed based on positive behavior supports, and social emotional learning and restorative practices would be embedded throughout the daily routines. And 2 mental health therapists would provide services at each site. So they would be assigned full-time to each of the sites to provide that individual and group therapy that those students might need. And that would all be determined based on their individual needs. Next slide. And as part of the vision, we do believe that that connection between school, families, and the community is critical. And so one of the things that we are proposing is that we have a mental health liaison, and part of the role of that mental health liaison would be to help make connections with those families, and not only connect families with the school, but also connect families with those community agencies that they might need to have a relationship with in order to support their child and grow their family relationships as well. Next slide. And then finally, this slide just provides a big view of what we're proposing with regards to the services and supports. So certainly the academics are critical. We want to ensure that students get the most rigorous curriculum. They have access to the same opportunities that students on other campuses have access to. So we would look for highly qualified teachers in those core academic areas to provide the instruction. We would also provide elective opportunities for the students. We would also use like virtual school, Florida Virtual School, and Edgenuity to fill any gaps that students may have with regards to earning credits or an elective course maybe where they have some interest, but we can't offer that at the school. So that would also be an option. The social and emotional learning would be a big part of the day. So as you can see, we would be looking at providing social skills instruction and critical thinking skills in all areas while students are learning. There would be a site-based positive behavior system in place as a tier 1 support for those students. So all students would earn points for positive behaviors, and certainly the philosophy of the school would be to look at what students are doing, that they're doing well, as opposed to that punitive approach for what they're not doing well. Restorative practices would be part of that, certainly to support students in repairing harm, mending relationships, and 2 of the programs listed there would be part of the curriculum materials that we would use. LEAPS is a social emotional learning curriculum that we already use in our district, and as is Zones of Regulation, and that program is designed to help students learn self-regulation skills and emotional control.
When you say that it'll be provided as a RTA level 1, I guess I'm a little confused because I understand you mean like a baseline, but like aren't all these kids like a level 3 RTI? Like aren't they, like there are most severe ESE kids?
Yeah, and that's a complicated question. So some students really, although they may have social and emotional needs at a very intensive level, as far as some areas, they may only need tier 1 support. So whenever you layer supports, there's always a tier 1, always a tier 2, and always a tier 3. So that behavior point system is really the tier 1. It's that positive behavior support system that's in place site-wide. And then you're gonna layer on top of that social emotional direct instruction with the teacher, where they're meeting with the student, they're doing lessons and LEAPS, they're providing instruction using the zones of regulation. And then in addition to that, they're also going to be getting one-on-one mental health counseling, group counseling. So there are still tiers of support that each student would be provided based on their needs. And certainly academically, many of our students with behavioral and mental health challenges have some pretty high-level academic skills. So they may only need instruction in that at a tier 1 level, and they may not need additional support from a paraprofessional. Where they really need the support is managing their behavior and regulating that behavior so they can access the instruction. Okay. And then you see the third column there, mental health and counseling, and of course, that would be an important part of what we do, something that would be at an intensive level that wouldn't be provided on our regular school campuses. And so all of the staff would be trained in youth mental health first aid, and the students would receive group and individual counseling based on an IEP team's determination. And those would be services that we would be providing. Our proposal is that we provide those services through a contract with Livestream, and they would have their mental health therapists on site full-time to provide those services to students. And then all of the staff would be trained in trauma-informed care, which is really important whenever you're working with students who have those social emotional needs, mental health needs. Understanding trauma and what role that plays in their experience is important for the adults in the environment to understand. And then, of course, the last piece is that all of the students at this site would have individual educational plans. They would all be eligible for an exceptional student education program. They would have behavior intervention plans, because if they weren't having challenging behaviors, they probably wouldn't be at that school site. And then based on their mental health needs, they would have individualized treatment plans. And then just added to this at the bottom certainly is very important that the district instructional framework, the academic program would align with the district instructional framework to ensure that students receive strong instruction, grade appropriate assignments, deep engagement, and certainly we would have high expectations for our students at those sites.
One quick question. Would any of these, well, I think I know the answer, but you would still utilize access points with those students who needed that?
Absolutely.
Okay.
We currently have students at Lake Academy who are instructed on Florida Standards access points, and we would continue to provide that.
One last question. This is going to be a big staff. So in order to have someone who has been trained in all these different unique areas, I assume we have a training proposal in place?
We do have a draft training plan, and as we get closer to those final decisions about the locations, then we will certainly make plans for that, because you're right, we have a lot of high expectations for the staff with regards to training them on these specific areas, so we do have a draft plan for that.
Okay. Very well done.
And this is, sorry, we don't have this presentation. This is K-8, right?
No, it's pre-K 12.
So will we be doing away with the Howie site?
No.
Okay.
No, not at all.
The Howie site stays. It won't have therapeutic support.
This is the 120 kids that right now Livestream has been taken care of. So we're going to be taking that academic component and bringing it in-house.
Right, okay. I just thought that we sort of did that for high schoolers already.
So remember a year ago when Lake Success, or has it been 2 years now, my goodness, we had the 45-day placement students that were also at Livestream, and we came to the board and proposed that we take those students back, and they are now the students that are at, this is a different group of students, those students are now at Lake Success.
Okay.
With that 45-day placement program. And this is the other group of students that remained, and I said then that it would be our intent and our vision to hopefully at some point in time be able to pull these students back under our academic services as well.
I
So,
understand. Okay, I get it now. Sorry. Thank you.
Okay, next slide. I'm going to ask Mr. Ward to help us here. This is our funding overview with regard to the program. Is Mr. Ward here? Oh, there. Do you want to? Yeah. Do you want to?
Sure. Next slide, please. So just kind of give you an idea of the thoughts on where we're going to pay for this from. The local capital outlay will take care of all of the needs for the facilities. If we need to add facilities, or if we need to do any remodeling, our $1.5 million local capital outlay funding will pay for that. Personnel, the personnel that she showed earlier on the slide, right now looks budgeting at about $1.1 million per site. Of course, as changes are being made, which sites and what kind of administrative need that would be adjusted up and down, but we're estimating at $1.1 million. Of course, these students do earn FEFP through the FTE process. That will be the primary form of payment of the cover the expenditures. Currently, the 0.75 millage is paying the difference between the FTE earned and the live stream contract, and I'll show that on another slide in just a second. So that will continue to happen. It'll be available to us if we need it. And then some Medicaid reimbursement, and then also some IDEA funding that would be available to the schools. Next slide, please. So if you look at this slide, this kind of shows what's happening with live stream contract now. The 2019-20 was the actual, and then the 2020-21 was if the contract was held harmless. As you know, the state held us harmless on our FTE. So if we held them harmless on their FTE, that's what it would look like. So both the sites in 2019-20, the regular FEFP earned was $2,300,000 for the 2020-21 year. It's again held harmless will be $2.3 million again. And then the transportation FTE earned $195,000 for 1920, $210,000 for 2021, and you can see the total earned from the state and local dollars is $2.5 million for 1920 and $2.6 million for 2021. The contract that we paid to Livestream is broken out in a couple of different pieces. There's the academic services, and then the transportation services, and then the therapeutic services. So total contract for 2019-20 was a little over $3 million, which is about $500,000 short, which means the $500,000 was paid for out of the millage funds. For 2020-21, it's about $3.5 million. And then the 0.75 millage covered the $800,000. We added the therapeutic services. That service was provided for free in the past. The idea of adding it to the therapeutic services is that we would be able to bill Medicaid for those services. It would also increase our transportation reimbursement. So the idea was that that would offset that. A lot of the services we're still waiting on documentation so that we can pay them for. But as of right now, we're estimating about $882,000 coming out of the 0.75 millage to make up the difference. Any questions? Next slide.
I'm sorry, I
Yes,
do
ma'am.
have a question. And I don't know if this would be you or, I want to call you by your first name, I'm sorry. But would we have any availability through Medicare to get back some of the behavioral reimbursement for the behavioral therapist? Are they gonna be certified? Or maybe that's you, Dr. Landry, I'm not sure. Is that something that we could recoup some money from?
That is something that is billable. When we provide those direct services, that is something that is billable and we can receive funding for.
Okay, thank you.
This slide just kind of goes to show, some of the things that we've run across. As you recall in Mr. Mock's audit, that he made the recommendation that we look at restructuring the way that the contract was. And one of the reasons why was because the number of students that we were paying for most of the time exceeded the number of actual students that were being served. So this just kind of shows you this year, and we know this year is a little bit different because of the dealing with COVID, but you can see that that there were, this is the academic, there were 76 students that started out for 6 days in August, and then if you take that versus the number of students that were not being served, and which would be $127 per day per student, that would be a $33,000 difference. And then as you go down each month, September, October, November, December, you can see the difference between the number of days and the number of students being served, and the difference between what we were paying for in contract and what we were the number of students that were actually being served. Next slide. So this one shows the transportation ridership. Again, the number of days are listed and the number of students were listed. And then the $19.72 per day per student. And when you look at that number of students not transported, that comes out to about $73,000 for the year. So what we're paying for versus the services that we were receiving. So we just wanted to put that in there to kind of show that reinforces that recommendation by Mr. Mock that the way that we were structuring that contract wasn't helpful. Any questions on these two last slides?
Any other questions about financing?
Yeah, let me go back to the FEFP, the slide on the income. Right there. And it's my understanding that you will be able, based on your budgeting, that we will be able to operate within the reimbursement that we're getting from, or within the revenue we're getting from the FEFP.
Yes, for the operating.
I keep saying FEFP, FTE, sorry.
Yes, sir. We're looking at the plan now for the staffing. It's about 2.2 million, and that leaves you about another 300,000 for other services and supplies, materials, et cetera. If it does increase over that, then, you know, we still have the 800,000 from the 0.75 millage that's being spent on that contract now that we could use towards that if needed.
Thank you.
On this chart, it says regular FEFP. Most of these kids would get weighted so this amount is actually low. I mean, we'd actually get more.
That is the weighted FTE.
That is the weighted,
Yes, ma'am,
okay.
that is the weighted FTE. So that is the actual FEFP that they're earning.
In the weighted column.
But we don't have you didn't give us a proposed budget, right? This is Livestream's budget, right?
This is live streams.
Current.
This is a recap,
Yes.
current and proposed. So we were going to have to go into our mental health component, $882,000. And the real takeaway for me is that we can educate better, because that's what we do, and do it within the revenue that we receive. That should be the takeaway.
And we'll have a little bit additional flexibility. If we don't have the number of students, we don't have to pay for the extra staffing that we're done.
See, that, we had a contract with them for 120 kids, no matter what.
Yeah.
Right? And so therefore, they have to offer contracts to teachers. So it's all kind of logical. In this way, we can bring them in and out as we need them based on student need. Yeah, a lot more effective. Okay,
Thank you.
that's it. Oh, that's it.
We have two more slides, I think. Next slide, yes, so mental health services, if you'll go forward, one more slide. Just wanted to remind everyone the services that we have been supporting mental health needs with from that millage fund. We have mental health liaison in every school. We provide these supports for all students, nurse in every school, our PASS teacher in every school, district health mental health specialists for at the district level that support this work. Mental health first aid training for our employees, Tier 1 wellness programs as well as some peer programs at our high schools, and then our 5 hours of mental health services. So we provide mental health supports for all of our students in all of our schools. Next slide. We also have a portion of funding that we provide to Livestream because they are our clinical support provider, and so we're going to continue that contract for the licensed clinical coordinator that works with our Tier 3 needs as regards to mental health supports, and then that provides some group counseling and training services as well as the mental health counseling services for students that are underinsured or uninsured, and so that pays that cost. Then we're going to add an additional contract of services because for these two schools, we still want to maintain the level of the clinical support. Our staff is not trained in the clinical mental health support, so we are going to contract with Livestream to provide that for our therapeutic setting. So that will provide mental health therapists up to 4, not to exceed $240,000. We believe that we can start with 1 and add if we need that based on the student numbers that we have, and then psychiatric services for up to 16 hours a month, which would be checking in with each of those students with a psychiatrist, which is also was provided in their setting, so we want to make sure that we maintain those Tier 3 supports. So we will still be using them as a partner in those areas.
Very good.
Next slide is just any questions? If not,
we don't have a proposed budget for it though yet, right? Like,
I'm sorry.
Scott, you showed us Livestream's budget and Livestream's budget for this year, but we haven't seen what our budget would be.
So we've looked at the staffing, which is obviously always the majority of the budgeting. So the staffing would be about 2.2 million to cover the staffing that she showed you earlier. That could adjust up and down based on site. And then there's a couple of $100,000 for some additional services And then, you know, the materials and supplies needed to run the schools or the sites will be added. So we're looking at, you know.
Roughly the same cost, but hopefully better services.
Correct.
That's the idea.
Yeah. And the idea is to make it close to self-sustaining as possible, so the FTE that's earned is also their budget.
Just like a regular school.
Yes, ma'am.
Okay. Any other questions? Thank y'all very much. This is very exciting.
Thank you.
Okay.
They've all been extremely busy planning for the summer and taking on this new program, and I'm so grateful. I tell you what, this group is amazing, and they have a heart for kids, and I'm just very, very thankful for all their hard work.
We're at board member comments. Mrs. Fluke?
Mr. Weeks is in the back, and I wanted to thank his team for the work that they did with our UCF students who are graduating in May. They spent the day with them via Zoom and helped them prepare for the Level 1 Google certification through not just, I've been to a couple of these trainings not provided by him, and it was very tedious and quiet, and his team always doesn't just talk tech, they talk instructional strategies, they blend the model for the students to see. So it's such a great thing to see. So we appreciate your expertise and the use of your IT people who are just engaging and wonderful presenters. So that, and I was going to ask, when are we scheduled to bargain? Start bargaining.
I thought we already were.
With LCA, we do not have a date on the calendar. Waiting to hear back from them, and then SEIU, we bargained last week, so you guys will be reaching out to you for an executive session.
Okay.
I'm still working on costing out.
Okay, that's it, thanks.
Mr. Dodd?
Yes, well, I had an opportunity to visit our district's STEAM Bowl, which is always a fun event and a great opportunity for our kids to get out of the classroom and put their STEAM skills to use. And I gotta say, I think the curriculum department has really got this down to a science now because, boy, it really looked smooth and very well done. So, great.
I enjoyed the STEAM Bowl as well, and I've been spending quite a bit of time at both Leesburg Elementary and Beverly Shores, and I'm very pleased to say that I believe, in my humble opinion, that they are on the way to making some really good changes and plans for the next school year, so I'm very excited to see what's going to happen there.
Dr. Burns?
My puppy put a shoe in front of the front door, and I promptly fell out of it, so I didn't make it to Steam Bowl. Or I fell over the shoe and twisted my ankle. So I really don't have anything.
Okay.
Just go right on.
Okay, I've got no comment. Superintendent?
I just wanted to let you know that we do have all of our graduation dates and locations and times all solidified, and so Ms. Painter will be sending that to you all to find out if you could respond as quickly as possible to let us know which of those you're going to attend, so that the schools are anxiously waiting to get their programs done, and so that it is that time of year, and so we're excited to be offering our face-to-face graduations again. All of them will be held outdoors on the football fields with the exception of East Ridge High School that will be at the UCF football stadium this year, so a new location for them. Also, I just want to let you know that the survey that went out to all the parents to let us know which instructional option they wanted for next year, the face-to-face or virtual option, has closed, and over 14,000 responses, 94% of them are coming back face-to-face, so we believe that is outstanding. We're excited about that. Just want to give you an update on that. And then just remind you that we have on Wednesday is our Alumni Hall of Fame luncheon. We'll be welcoming 4 new inductees, and so I want to congratulate those individuals. Jacqueline Ashley, Leesburg High School graduate from 1970. Denise Burry is from Tavares High School, class of 1983. Keith Murphy is from Mount Dora High School, class of 1982. And Dr. Clarine McCall is from Carver Heights High School, class of 1958, and they'll be our inductees that we'll look forward to seeing on Wednesday. And that was all I have.
Okay, Mr. Johnson? Okay, this meeting is adjourned.